This video demonstrates two examples of communication strategies in dealing with a stressful client situation. The first scenario represents a reactive response that resulted in ineffective communication. The second, on the other hand, highlights responsible and professional communication that results in a different outcome. As you watch these, we invite you to choose which strategies you might use. At 8 a.m., Joanne, the unit manager on a dementia unit, received a doctor's order to obtain a CBC blood specimen on a patient, Mrs. Smith. Furthermore, the sample needs to be sent to the lab today. The unit manager, Joanne, asked one of the nurses on her unit, Pat, a newly licensed nurse, to do this for her. Pat agrees to do so. Joanne is very specific with Pat that she obtained the specimen in plenty of time to make the pickup deadline. The lab pickup is at 2 p.m. At 1:40, the driver from the lab arrives to pick up whatever specimens need to go to the lab. Joanne, who was just hanging up the phone after being reprimanded by a doctor over another incident, is notified by the unit secretary that the lab driver is here 20 minutes early and the CBC specimen from Mrs. Smith is missing. The unit secretary further reports that the lab driver is very impatient and will only wait 5 more minutes. Joanne goes to look for Pat and finds her in Mr. Green's room.
Excuse me, Pat, but the lab's here to pick up Mrs. Smith's specimen. Do you have it ready? Where is it?
Joanne, this is the first chance I've had all day to get to it. As soon as
Pat, I
I'm done...
entrusted you with this simple task and you've let me down. Just what have you been doing all day?
I've been busy. Just let me tend to Mr. Green and I'll come and speak to you.
Well, you better.
Pat obtains the specimen, but the lab driver leaves before she can get the specimen to him. Pat goes to Joanne's office with the bad news.
Excuse me, Joanne, but I have some bad news. The driver left before I could give him Mrs. Smith's sample.
What am I supposed to do now? Give me one good reason why I shouldn't fire you. How hard is it to get a CBC?
I'm sorry, Joanne. I just didn't get a chance to do it today.
Get out of my office.
Sorry.
Another nurse who had been observing the event goes to Joanne's office in support of Pat and tries to explain to Joanne why Pat was not able to obtain the specimen on time. Joanne was informed that Pat had 2 admissions today, 8 patients with the flu, 1 patient who is actively dying, and she had to send yet another patient to the hospital with a suspected left hip fracture. Furthermore, she didn't take a break all day, not even for 5 minutes. She also reminded Joanne that the lab driver was 20 minutes early as well. About an hour later, Joanne calms down and realizes that Pat had a very busy and very difficult day. Regretting her behavior, she decides to make amends with Pat.
Hey, Pat, can I talk to you for a minute?
Sure.
Hey, look, I'm sorry for my outburst earlier. I wish you had come to me and told me you were having a hard time. I could have helped you with something.
I know I should have, but I was afraid you would have thought I had poor time management skills or incapable of doing my job.
Oh, hey, anybody can have a chaotic day.
Well, you know, I have an idea. I drive right by the lab on my way home from work. Why don't I take Mrs. Smith's specimen with me?
Oh, great, thanks.
Now, let's take a different look at the same situation using a respectful, assertive communication technique. How do you think it might turn out differently? Joanne, taking a few moments to compose herself, then goes to look for Pat and finds her in Mrs. Smith's room. Upon seeing Pat preparing to obtain the blood sample from Mrs. Smith, Joanne becomes concerned.
Excuse me, Pat, can I talk to you privately for a minute? The lab is here to pick up Mrs. Smith's CBC. Have you had a chance to get that?
I'm sorry, Joanne. This is the first chance I've had all day to do so. I'll get it right away.
Do you need help with Mrs. Smith, or is there anything else I can do for you?
No, I think I'm good, thank you.
Okay, bring it out when you get it ready. I'm going to go talk to the lab driver and see if he can hold off for a few minutes.
I will right away, Joanne.
Thanks.
Pat obtains the sample, but the lab driver leaves before getting Mrs. Smith's specimen to him. Pat goes to Joanne's office with the bad news.
Excuse me, Joanne, but I have some bad news. The lab driver left before I got a chance to give him Mrs. Smith's sample.
What happened, Pat? I thought that you were going to have plenty of time to do that.
Well, I had every intention of doing so, but it just became a difficult day, and, things went wrong, and the day just got the better of me. What should I do in the future if this should happen?
Well, I understand it was a very difficult day, and the lab driver did show up early. Please, in the future, if you're finding yourself bogged down or overwhelmed, just come and talk to me, and I can give you the support and assistance that you need.
I will, Joanne. It's just that I was afraid that you would think I had poor time management skills or I was incapable of doing my job. But you know what? I do appreciate your understanding. This gives me an opportunity to think about how we can better solve this problem the next time.
Hey, anyone can have a chaotic day.
Yes, you are right. Say, I have an idea. I drive right by the lab on the way home from work, so if it's okay with you, why don't I just take the specimen with me?
Well, thank you. That's a great solution.
Good.
Thanks.
You're welcome.